Hi, I'm Dawn Morse, the founder of Core Elements Training, which delivers Level 3, Level 4 and Level 5 sports massage and sports therapy training courses.
I'm Katie Campbell, I'm a lecturer for Core Elements Training. In this series of videos we're going to be looking at the examination assessment for the peripheral joints, focusing on range of movement, ligament testing and muscle testing. In this video we're going to demonstrate the examination assessment of the ankle joint, looking at range of movement, active, passive and resisted ligaments and muscle testing. Back to lie on the couch please, face up. Yes. So for the range of movement we're going to look at dorsiflexion. So actively just ask your client just to bring their toes up to them and relax. You'll be assessing from good to bad, but for this purpose we're going to just focus on this leg. Passively, the therapist will take it further than the active range, so you ask the client to actively perform the movement into dorsiflexion. Just cradle underneath the heel, your forearm up their foot. You're just increasing the movement by pushing the foot closer to them. Passive. For resisted, we repeat these steps. So the foot, just dorsiflex the foot again. And passively, the therapist supports underneath the calcaneus, forearm against the bottom of the foot, and increases the range of movement with the client relaxed. For the resisted movement, we ask the client just to push their foot away as if they were going to step on tiptoes. Hold for 3 seconds and relax. For plantar flexion, we ask the clients to point their toes down and you position your hands on the tibia just above the ankle joint line and cross just below the talus. So the passive part of the movement, the therapist will take that range of movement further. So ask your client once again to put their foot down, position your hands, and you're just trying to increase the movement there. So your hands are above and below the joint line, just trying to increase the movement after you've actively performed plantar flexion. The resisted part, the client actively performs the movement, so pointing their toes away. Therapist passively moves the joint further into plantar flexion. Then we ask the client to bring their foot back into the starting position, matching the therapist's resistance. Holding that for 3, and then relaxing. So it's plantar flexion and dorsiflexion. Or then we could do inversion and eversion. So we ask the client to just try and bring their foot inwards. So the plantar aspect of the foot, just bring inwards as if they were going to clap with the bottom of their feet. Again, holding just above the joint line, above and below. You just want to increase that movement for the passive part. So when you want to do the passive movement, the client brings their foot in to inversion, support the ankle and just extend the movement further. So you'll just bring the foot further into eversion. When you want to do the resisted part of the movement, the client again inverts the foot. Therapist takes that a little bit further with the client relaxed, and then we resist by the client bringing their foot back to the starting position and the therapist resisting them, matching the resistance and relaxing. For eversion, the client brings the plantar aspect of the foot outwards. They're just trying to bring the foot outwards. The therapist, for the passive part, again supports just above the foot. So the client actively performs the movement. So on the bottom of the foot, you're just trying to bring the foot back round. You could do it in this position, or you can do it standing like this. The client brings the foot back outwards. Go to a slight lunge, support at the bottom of the calcaneus and bringing it round. You're supporting the foot and you just bend round. For the resisted part again, you go into the same movement and then try to get back to the starting position. So actively ask the client to bring the foot out, the plantar part out. Passively support above the ankle and the bottom of the foot. Increase that movement with the client relaxed, and they try and bring the foot back to starting position. You hold that for 3 seconds and relax. So it's inversion and eversion, plantar flexion and dorsiflexion. That's your range of movement, active, passive and resisted. Test the ligaments. So you've got the anterior talofibular ligament, and this is performed by, I'll show you on this leg. We test this by plantar flexion and inversion. Just above and below the joint line, you just gently try and stress the ligament, also known as the ATFL. For the calcaneofibular ligament, CFL, put the foot into neutral and then into inversion. Again, just trying to stress that ligament. Posterior talofibular ligament, PTFL, we put in dorsiflexion and then eversion. Again, hold just above the joint and the foot and just gently stress that ligament. The medial collateral ligament or the deltoid ligaments in neutral and in eversion. So you can gently take the capsule and stress the ligaments by everting the foot in neutral. For the muscle testing, we're going to test the tibialis posterior and anterior, the soleus and the gastrocnemius. So as the client's on their back, we can test the tibialis anterior. So we ask the client to put their foot into plantar flexion and eversion. And what they're going to try and do, you're going to support the foot and they're going to try and bring the foot back up into dorsiflexion. You just support here and they bring their foot up, and again you're seeing how well the muscle can contract, holding it for 3 with the therapist and the client using the same resistance. And relax. For tibialis posterior, put the foot in dorsiflexion and eversion. You're trying to hold the foot in that position while the client is trying to bring the foot back round and down. So the client's trying to invert and plantar flex. Again, hold that for 3 and relax. That's tibialis posterior. We'll turn the client over to test the soleus and the gastrocnemius. For this one, we want to make sure that you don't push the client's foot into the couch. It can be very uncomfortable, especially if there's buckles there. So if we ask the client to move down a little bit further. So here, client, we're going to test the gastrocnemius. We know it crosses the knee. We're going to ask the client to dorsiflex the foot, bring it up. Use your thigh to support, keep that position, and all they do is just try and push away, try to stand on tiptoes. And again, you might have to hold the leg in case they slide up. Hold for 3, and the client can relax. Test the soleus. We know it doesn't cross the knee. So we just bend the knee, then ask the client to bring their foot down towards the couch or dorsiflex, supporting the calcaneus there, using your forearm across the foot. We're going to hold that foot in place while they try and push up to the ceiling. And this tests soleus. We can also test the perineum with the client lying on their back. So the perineum evert the foot. So we put the foot into inversion. So ask the client to invert their foot, pop their heel on put the plantar aspect of the foot inside, supporting just underneath the lateral malleolus and the lower leg. They try and bring their foot back out to eversion. You're holding, and the client matches the therapist's resistance, and again hold for 3 and relax.
Thank you for watching our short video. This video forms part of our series in examination and assessment. So the series includes examination and assessment of the shoulder joint, of the elbow joint, the wrist joint, hip joint, knee and ankle joint. And the activities covered within these short videos supports the topics covered within our Level 4 Sports and Remedial Massage course. If you'd like to know more about our Level 3, 4 and 5 accredited qualifications, then please go to our website. And our website also details information on our short CPD courses as well. If you'd like the link to our website, then that's detailed in the information below. Okay, thank you.
Thank you. Goodbye.